There is one organ which causes high blood pressure, and it's not what you think. And there are specific exercises you can use to target and fix your blood pressure easily. No diet, lifestyle changes, or medication required. Check the link in the description below, but for now, today's question.
The question: what do you take blood pressure with? Answer by Michael Soso. Perhaps the op is looking for the technical term for the traditional BP measuring device. It is called a sphygmomanometer. The illustration shows an aneroid cuff. Traditional ones were wall-mounted, mercury manometers, which are out of favor because of the toxic mercury content. Answer by VJ Bharti. It's just called a blood pressure machine or a blood pressure monitor. Very common instrument. However, it does squeeze your arm quite a bit to get an accurate measurement, so be cautious. Answer by Poya Jazari. Blood pressure is normally measured using a non-invasive blood pressure cuff. It's an inflatable cuff that goes on your arm. You pump it up and then slowly decrease the pressure and note when blood first gets past the cuff and when it reaches equilibrium. These are your systolic and diastolic pressures. You can also measure with an arterial line, which is an invasive measurement. A catheter is placed in an artery, usually the radial. It is hooked up to a pressure transducer, which tells you what the pressure is each time the heart beats. This is used in the operating rooms and intensive care units for very sick patients. Lastly, you can put your finger on a person's pulse and get an estimate of systolic blood pressure. If you feel a carotid pulse, it's at least 40. If you feel a radial, it's at least 80. Femoral is somewhere in between.